Hi folks, Dr. Ed Beyer. Today we're talking about the underlying causes to female hormone imbalances, the things that traditional medicine doesn't look at, and their answer to everything is just to go on the pill. All right, and that just causes a whole downstream of negative impacts, negative effects on the female body. So we don't recommend that. We practice functional medicine. We want to know what is driving the imbalance in the female. One of my favorite topics is estrogen dominance. Okay? Just generally speaking, estrogen is the hardest hormone to get rid of out of the female body. It lives the longest in the body. So if there's any problem with detoxification or gastrointestinal problems, it's pretty much a safe bet that estrogen is going to creep up. Number two, estrogen, there are estrogen-like compounds in the environment everywhere. They're ubiquitous. We call those xenoestrogens. These are compounds in our environment that turn into estrogen in the female body and male body, or they increase the impact of the estrogens that are already there. And then phytoestrogens are compounds found in plants or foods that act like estrogen in the body. We'll be discussing these. So bear with me on this. It's kind of a lengthy topic, but I'm going to get into it, and I'm going to hopefully do a good job covering it. So these are chemicals found in foods and plants that mimic the action of estrogen in our body, thus altering the hormone balance. Most female problems are due to an imbalance between estrogen and progesterone in the body. That balance between those two hormones, especially in the second half of the female cycle, are extremely important for health. So xenoestrogen chemicals, pesticides, herbicides, fungicides, plastic goods, plastic containers, especially if they're left in the sun and heat, creams, cosmetics, parabens. Now, it's so much easier to avoid these days because there's a demand for it. People are learning about this because of people like me teaching people that you can demand this and get these things free of estrogen, xenoestrogens, your cosmetics and everything. Nail polish remover, all have an estrogen-like impact on the body. New carpet, fluoride. We should be not drinking tap water. We should be filtering it. Fabric softeners, you can get fabric softeners that don't have them. All of these products are available without having the estrogen damaging effects. You just got to figure out how to get them. Microwaving food in plastic containers and wraps. The three sites of the female body that are really sensitive to excessive estrogen is the breast, uterus, and thyroid. This is one of the reasons why 1 out of 8 females gets breast cancer, because estrogens are everywhere and they're hard to eliminate out of the body. How to minimize the xenoestrogen exposure? Filter your water. Eat organically so you're not consuming these pesticides, these chemicals. Hormone-free meat and dairy. I know it costs more, but you know what? We live in this body. We only have one body. We live in it 24 hours a day. Glass or ceramic for storing foods, not plastics. Simple laundry and dish detergent with less chemicals. Organic soaps and toothpaste. Natural skincare products. Natural-based perfumes. Most perfumes are petrochemically based, which are estrogenic, xenoestrogens. Now, phytoestrogens are naturally occurring estrogenic compounds that are found in a variety of plant foods like beans, like especially soy. These are known as isoflavones. Seeds and grains. Some of these can be beneficial. Sometimes they can be detrimental. I'm going to cover that. They may affect the production or breakdown of estrogen in the body, and they may also block estrogen's effect in the body, which sometimes is a good thing. They are weak estrogens compared to real estrogens that we see in hormone replacement therapy or xenoestrogens. So phytoestrogens tend to be weaker. And sometimes the weakest estrogen, which is called estriol, will sometimes block the damaging effect of the strong estrogen, estradiol. That's when it'll be beneficial. So sometimes we use these clinically, things like soy or black cohosh, chasteberry, dong quai, red clover. These are natural things that have been used for hundreds of years to balance female hormones. They can be detrimental though if you are in a state of estrogen dominance. Now, estrogen dominance is a condition where estrogen is too high and or the ratio between progesterone and estradiol, the strong estrogen, is too low. All right, so we really want a ratio, proper ratio between progesterone and estrogen in the luteal phase, which is the second phase from like day 12 to the time a female gets her period. We want that to be 25-1, and I will tell you, I hardly ever see that clinically. So when we measure a female's hormones, we usually do it with saliva. We always have them do it during that phase of their cycle, like day 21 to day 24 in their cycle. So if it's below 25-1, that is a state of estrogen dominance, and that creates a lot of problems. Estrogen dominance is the main driver of PMS. It causes growth. Extra estrogen causes growth. Just like it was estrogen that helps mature a female's breasts and vaginal canal and ovaries, all their sex organs when they were going through puberty. It was estrogen that did that. All right, so and it continues to cause growth of any cancerous cells or things you don't want growing if estrogen is too high later in life. So like fibrocystic breasts or uterine fibroids or endometriosis. Yeast infections it can cause. Yeast loves estrogen. Low libido, heart palpitations. I cannot tell you how many females I've had, as soon as we balance their hormones, heart palpitations go away. Hair loss, bone loss, weight gain, endometriosis, miscarriages, anxiety, depression. High estrogens have huge impacts on serotonin and dopamine and catecholamines in the brain. It contributes to estrogen-based cancers, and estrogen dominance stops a female from converting the inactive T4 thyroid hormone over to the active T3. So we see it as a role in thyroid problems. Why is estrogen dominance so prevalent? Number one, there's so many more females going on birth control. When you go on birth control, you stop ovulating. When you stop ovulating, your progesterone levels plummet and your estrogen levels go too high. So that ratio is not 25-1 anymore. It's much lower, and that's estrogen dominance. Because there's so many more xenoestrogens and phytoestrogens are everywhere. People's livers are working harder than ever because there's so many chemicals that have to be detoxified in our bodies. Estrogen has the longest half-life. It's the hormone that lingers the longest in the body. Obesity. Fat cells store estrogen, and they make estrogen. So if you're overweight, you're going to have extra estrogen. When a female is pregnant, they have 9 months of huge more amounts of progesterone, and that balances the effects of extra estrogen. And so females, as a rule, are having less pregnancies during their life than versus 100 years ago. Constipation. If you're not having 2 bowel movements every day, those estrogens are getting reabsorbed right back into the bloodstream. And if your liver and gallbladder aren't working very well, then you're not getting rid of your estrogens. Another reason is progesterone levels start to drop in a female in their young 30s. And by the time a female is 50, which is about the average age of menopause, they are producing 75% less progesterone. And while estradiol only drops 35% by age 50. So that skews that progesterone estrogen ratio, which is very important. So low progesterone is often the cause of estrogen dominance. It's the ratio that's the key. Proper testing is important. So it's a very important topic. I hope it made sense. I'm Dr. Beyer. Have a great day.